too much. Also in today's HealthCast, a look at how some healthy foods can actually cause serious problems when you mix them with certain medications. Cardiologist Dr. Soffer shows us some of the combinations that cause the most frequent problems.
Grapefruit and a banana sounds like a healthy way to start your day, but not if you are on a certain blood pressure medication or cholesterol drug.
If a patient is taking a banana a day and they're also taking a medication that can increase their potassium, then both together might make their potassium too high, and that can actually cause some cardiac problems.
ACE inhibitors like lisinopril are a good example. Grapefruit interacts with many different medications, both increasing and decreasing the effectiveness. If you're on statins for cholesterol and certain antihistamines, pay attention to your grapefruit consumption. Dairy products plus other foods rich in calcium are another potential problem group.
Those can interfere with medicines. A good example of that would be the tetracycline medicines, doxycycline, ciprofloxacin. Those are antibiotics.
Anyone on thyroid replacement needs to pay attention to what they eat.
The correct way to take a thyroid medicine is to take it on an empty stomach.
Foods with soy, including soy sauce, tofu, soy milk, can affect absorption, but many also believe something about the soy also worsens thyroid conditions. Pickled, cured, and fermented foods contain tyramine.
And really the medicines that you need to be concerned about with tyramine is the monoamine oxidase inhibitors, some Parkinson medications.
That combination can produce a dangerous increase in blood pressure. The blood thinner warfarin, or Coumadin, is sensitive to vitamin K-rich foods, including a long list of healthy things like kale and other leafy greens. If you're on Coumadin, it is essential to talk to someone about your diet. Finally, alcohol. Most medications and alcohol do not mix. Often problems like drowsiness and confusion can occur, but far more serious problems are possible. For example, alcohol plus the common antimicrobial flagell causes most people to become violently ill.
Severe nausea, severe vomiting. They could have very bad dizziness.
I've seen the repercussions of mixing food and certain medicines, which is why it's so important to talk to your doctor or pharmacist when you start a new medication. It's always a good idea to ask whether you should take it with meals or not, and if there are any specific foods that should be avoided. With your second opinion, I'm Dr. Soffer.
And I know it can be kind of confusing, right? So the Food and Drug Administration now has a detailed list of the foods and drugs and the interactions they may cause. You can find that list when you look at this story at local10.com. Janine, so many